Okay, so the next topic will be on addressing information processing speed to improve overall cognitive function. I'm honored to given chance to chair this session by Ms. Regina Maniam. I would like to kindly introduce Regina as an occupational therapist at Malacca General Hospital. She's a senior occupational therapist. When she obtained Bachelor of Occupational Therapy from National University of Malaysia (UKM) and in year 2008, and I know her since then. And she have already pursued her Master of Science in Clinical Neurology from University of Sheffield, UK in 2015, and now she has already like more than 14-15 years of experience in various clinical areas, and I know she specializes in neuro rehabilitation, work rehabilitation, and pre-driving assessment and training, and she has very passionate interest in cognitive rehabilitation. That's a topic she's going to bring about today. And I would like to say something else also about Regina. She's Ministry of Health OT's technical committee member, yeah, and I'm proud to say she's now pursuing a PhD, and we would like to congratulate her and all the best. And even though she's currently on study leave, but she's still actively involving in herself in all the areas, yeah. So she's looking forward and aiming to develop comprehensive rehabilitation care pathway for return to work and driving for people with neurological deficit in Malaysia. With that, I would like to call upon Ms. Regina Maniam to deliver her presentation.
Thank you, Mr. Tillai, for the kind introduction. Hello, everyone. Like Mr. Tillai introduced, I'm Regina, occupational therapist. Today, I would like to share addressing information processing speed to improve overall cognitive function. This is my past 15 years. I've been working with patients with neurological deficits, and cognitive is one of the things that is quite complicated because it's like involving a lot of components. And throughout my experience treating patients for return to work, specifically for stroke patients, the one component that I realized that improved the overall cognition is the processing speed. Alright, so whatever I'm sharing here is through my experience, a bit of theory and also the practical points lah. Alright, so my lecture will be like contain of introduction to information processing speed. I'm sure most of you already know what is processing speed. It's just a recap on what is information processing speed and how information processing speed in aging brain. So I have experience treating patients like pathological aging, slowing down of processing speed. But we will look into what is processing speed in aging brain, and also after that I'll cover on neurological conditions that slowing down the processing speed, and how what are the ways to improve information processing speed. All right. So first of all, information processing theory. This one is an approach to cognitive development that suggests a way in which humans process the information they receive. So this is like we take the computer analogy. It's just like our computer. So we have your input devices, which is the sensory memory for us, like environment, what you receive through your senses, what you see, what you hear, or the touch, all the senses. And then you have a processor in the computer, which is the RAM, which is working memory for us. And then you have your output, what you see on your monitor. So for us, how we function in our daily living activities, like performing daily living activities, how we your learning capacity and all. All right, and you all this processor is depend on your hard drive storage as well. So in our human brain function, so you have your incoming what is that, your information, like I said, from your sensory and your memory, and then you have your short-term memory or working memory, and then you have your elaborative rehearsal, and then it goes to your long-term memory. So above all, you have your executive function, which involves the attention, and then your maintenance, rehearsal, and consolidation. Alright, so people often they say, oh, I've forgotten, or I like easily forget things. It could be the registration of the whatever they receive, and then how they process. Okay, so if they have the slowing down in processing speed, and then the whole process will be affected. That's why the registration or retrieval will be slowing down as well. Alright. So the idea of information processing is, it's a model on how human thought works. Alright, for example, the eye, your eyes receives visual information and codes information into the electrical neural activity, and then in the brain it's stored and it's coded. Alright, this information can be used by other parts of the brain relating to mental activities such as memory, perception, attention. So when we talk about cognitive training, we always talk about memory, perception, and attention. So but these three depend on the processing speed. Alright, and then the output, for example, your behavior might be, for example, to read what you can see on a printed page. So when you see something, to process it before you register how fast you can process it, that's what we call information processing. Alright. So when talk about information processing speed, the synonyms are cognitive processing speed or processing speed, or some people they mention reaction time. Like for driving, you have to have very good reaction time or very fast reaction time, otherwise you will be like, people will be honking at you lah. So it normally happens in our daily living, right? So the speed, when you talk about speed, is the measure of the efficiency of cognitive function. How fast you can respond, how fast you can memorize things. So this is the measure, that's what we call information processing speed. So it also expressed in terms of, like I said before, reaction time, the time required to complete a series of operation, or the number of items answered correctly in a set period of time. So it's all about, comes back to your time taken to do certain things lah. Alright. So what are the components of processing speed? So you have three things. Now you have yourself, your brain, alright, and then you have some tasks that you have to do, and in relation to your time, how long you take to finish your task. So these three things comes with your output, alright, your focus, how you can focus, the energy you put in certain tasks, alright, and also your control and your automatic functions. Okay, so it's always task and comes with the time. Alright, so when talk about processing speed, it always comes back to time. Alright, so what are the things causes the slowing down of processing in your brain? Alright, it's attributed to a combination of neurochemistry alteration and malfunction of certain brain circuitries. Alright. For example, some researchers have hypothesized that alteration of white matter integrity are related to processing speed deficits. So specifically, the white matter in the brain's frontal lobe, which is the area that controls executive function, is reduced in those with slow cognitive processing speed. Alright. Such dysfunction affects signals from passing between neurons as they normally do. So it's like related to your white matter, especially in your frontal lobe. Frontal lobe, executive function, your planning, your organization, registration, attention, all is from your frontal lobe function. So what happens in aging brain? Okay, so normal aging is one of the reasons for cognitive slowing. So when we get older, we might be a bit like to do multitasking, it's a bit of a struggle. So memory struggles common to aging adults are primarily a result of generalized cognitive slowing. So we talk about memory, actually the problem underpinning memory problem is the slowing down of the processing speed. Okay, the tendency to process information more slowly as we age. Alright. Slow processing speed can be experienced in certain attentional tasks or when switching from one task to another. For example, you are doing something in your room, and then you want to take something from the kitchen and you walk out, you don't know what you want to do the next thing, alright. So switching task to task, you always have problem, or multitasking. So that could happen due to normal aging. So like people like at the age of more than 40, so more challenging to quickly recall new information. Some people say that when you have like at the age of 40, you have too many things in your mind. So that could be a reason also. But generally as age, people become a bit slower in their processing speed. So it could be other factors apart from pathology, like for example your stress, alright, and also sleep disorders and nutritional deficiency, which has negative effect on the brain generally, which can slow down the processing speed. Alright, so this is just a summary of what happens in your brain, and generally aging itself can slow down the process. Alright, processing speed is one of the strongest predictors of performance across cognitive tasks in older adults. That means when you assess an elderly person, if they have slow in processing speed, that can predict they can have other cognitive impairment. So and also it could be early detector for dementia and all, the slowing down of processing speed. And it is the foundation of major hypothesis for age-related cognitive decline. So this is the hidden thing that underpinning all these other cognitive decline. Alright, the early neurobiological explanation says that cortical declines in neutrophil and myelin. Okay, one of the pathophysiological mechanism underlying the structural changes associated with processing speed appears to be the cerebral small vessel disease. So I think this cerebral small vessel disease is like it's like causing a lot of other problem also. When you talk about dementia also, they talk about the small vessel diseases as well. Alright. So now we talk about what are the neurological conditions that can slow down the information processing speed. So these are some of the example, but generally any insult to the brain can slow down the processing speed. For example, I have seen many stroke cases. Okay, so in stroke studies, or particularly for cognitive impairment post-stroke, the information processing speed is the cardinal feature that underpins post-stroke cognitive impairment. So the studies among stroke patients shows that slowing down information processing speed reported among 50% to 70% of stroke survivors. So and also some studies show that when they work on improving information processing speed, it would generally improve the cognitive function among stroke patients. It's not only the cognitive improvement, it relates to the physical recovery as well, because for stroke patient or any patient with neurological deficit, when you're training, the learning has to be there. For example, you're teaching them to for exercise, your upper limb, the learning capacity has to be there for them to learn the physical tasks. So when you work on this information processing speed, it improves the learning capacity as well among this stroke patient, which ultimately contributes to the general recovery of the patient. Alright, in other stroke conditions, in multiple sclerosis, for example, it is estimated that 40 to 70% of patients have cognitive deficit. The information processing speed is one of the most affected function. If you see papers 10 years ago, they won't be talking about information processing speed, but they will be talking about particularly for multiple sclerosis, the cognitive decline is due to the psychological factors. Like most of them, they with the anxiety, depression, because of the disease, they have psychologically affected. That is the cause for their cognitive decline, and also medications. But the underpinning reason actually is the information processing speed, which could be related to psychological factors as well. Alright, the processing speed is a primary cognitive factor in multiple sclerosis, influencing quality of both activity and participation in everyday life. That could be the reason they decline in the performance in daily living activities and also work production as well. Another condition that I would like to bring it here is the Parkinson's disease. This is one of the neurodegenerative disease. So bradyphrenia or slowness in the information processing produces alteration in the speed of thought, but also increases attentional impairments, cognitive inflexibility and forgetfulness. So when you work on the processing speed of this kind of patient, there are improvements seen in the overall cognitive function. Alright. So how this speed of processing on cognition and everyday function. Alright, so in your daily living task, everything need your processing. Alright, whatever you see or you need to make some decision, it all comes back to your function as the end product. For example, like I already mentioned just now, driving is one of the tasks that you need to have very good reaction time. And then your driving space, your life space, falling, gait and balance. Like gait and balance, why? Because when you're walking, you need to decide, right? So how fast you process, there is a curb there and then you need to pass the curb. So if you process very late, that's why it can cause the fall as well. But of course, this is multifactorial. That means it's not the sole, factor. It's affected by other things as well. But one of it is the processing speed. Alright, and then timed instrumental activities. For example, you need to cook. When you're cooking, you need to know when you need to add in the ingredients. How fast, like if you put too late and then you overcook or undercook. If you put too early, it will be overcooked. Alright, so these are the things, every single thing in your daily living activities is, comes back to your processing speed. Alright. So how do we improve this information processing speed? So neuroscientists, they have investigated the neural correlates associated with the performance of elementary cognitive tasks. The current research uses electroencephalography to compare brain activity differences between fast and slow performers. Brain speed improvement is based on making more solid neural connection, which allows the signals to communicate faster between one another. Alright, so generally we come back to the neuroplasticity. So if like neurons fire together, they work better and better networking and all. So how to improve the neuroplasticity? So that's the thing that I want to share next. Yeah. So thus the way people's brain is wired and organized provides a hint of their processing speed. It's not how much things you do, but how you do it. I mean, like what are the activities you do? Alright, that matters to target the information processing speed. Alright, people ask you, okay, when you, like a lot of talks, we talk about improving cognitive, like eating better or healthy lifestyle. But actually, what are the, like they say, you need to give some stimulation to your brain. So what kind of stimulation you need to bring to the, you need to give to the brain? Like for example, they ask you to do puzzles or crosswords. But how this can improve your general cognition? So what I'm trying to say is you need to address that processing speed, which ultimately can improve your other components. Alright. So there are many, if you read about it, a lot of intervention is there for improving speed of processing. So one is the brain stimulation. We will go into detail the next slides. And then you have computer-based non-verbal exercises, which is involve target detection, identification, discrimination and localization, and the different kind of activities that can you do. And then there is one thing called time pressure management. This is more on compensatory method on how to improve processing speed. And then my background is occupational therapist. We always talk about how you can take these daily living activities as a therapeutic medium to improve your cognitive. That means you don't need like purposely go and sit and do this activity. So it's like not many elderly will like it. Like you ask them to sit and do some like worksheets and all, they'll feel like this is not like suitable. So how you can take this occupation? Like occupation for us is what you do every day from you wake up until you go to sleep. What are the activities you do that we can make it as a therapeutic medium? Alright. And primarily it involves practice with feedback. That means you need to have feedback to the patient, otherwise the learning is not there. Alright, so we have one concept which is called errorless learning. That means through the process somebody has to give feedback to reduce the error so that patient don't make mistakes. Alright. So first of all is the brain stimulation. So innovative brain technology is emerging in order to improve cognitive functioning. So I think a lot of things people talk about stimulation which directly affecting the neural plasticity. Alright. Non-invasive brain stimulation provides safe and relative low-cost methods to optimize cognitive functioning. What are the techniques that are already in place? Like a lot of studies going on this kind of brain stimulation. Some of the techniques are transcranial magnetic stimulation (TMS) and transcranial direct current stimulation (TDCS) are being used already as a therapeutic option to treat various neuropsychiatric disorders with excellent results. Alright, and these techniques deliver very low levels of constant current to specifically targeted areas of the brain, exerting an influence on their brain waves. So this is all about brain waves, like sleep studies and a lot of things now they're using this TDCS and TMS, alright, or neurofeedback. So this TMS and TDCS, TMS uses the pulsing electromagnetic coil positioned near your head to generate a magnetic field to stimulate the brain's nerve. Okay, alright. The higher intensity treatment, greater stimulation per treatment. Patients need to attend a clinic with specialized equipment and trained clinician to receive treatment. In Malaysia, we don't have many places with this kind of facilities. One of it that I know is Region Hospital that from they're doing this TDCS, and TMS I'm not sure. Alright, so TDCS uses a small battery powered device to deliver weak electrical currents to stimulate the brain. So patients can self-administer treatment at home under the guidance of clinical team. TDCS is completely different to electrical current neurotransmitter. Alright, so these two, but then we don't have long-term studies. Like for example, the sustainability of the skills that they already learned. So for example, they have better attention, but how long the effect it lasts. So that one I don't have any evidence to show to you. But maybe there are studies going on in neuro rehab fraternity. Alright, so the prediction, 3DCS has the most readily available and cheap device to improve processing speed in children and adults experiencing slow processing speed. And TMS interventions, patients with severe cognitive impairment, for example, depression, stroke, movement disorders, epilepsy and pain with associated symptoms of slow processing speed. So like the normal modality that used by occupational therapists or any other therapists for cognitive improvement is the computer-based training. Alright, so there is this research by Bioclinic Research where they assessed healthy older adults who participated in a computer-based training program to improve the speed and accuracy of brain processing, showed twice the improvement in certain aspects of memory compared to control group. That means they only worked on the processing speed, but the outcome they can see that there is a better memory among the experimental group. Alright, what are the programs they did was watch educational videos on art, history and literature topics. They completed quizzes on the content. Then participants were asked to distinguish between high and low pitched sound, because this one you have to listen and you have to process, alright. So high and low pitched sounds. To start, the sounds were slow and distinct. Gradually the speed increased and separation disappeared. Matching or distinguishing between similar sounding words, for example pop and pot, also were part of the skills building. Alright. Now I think a lot of companies, medical companies, biomedical, they come up with a lot of technology which has all these kind of programs for cognitive impairment or improving the cognitive function. And also if you just in your phone, if you type on your app store, yeah, so you just try cognitive booster or whatever, there are so many various apps for cognitive. So one of the things that I always suggest my patient to download is there is one called Brain Yoga. So when you download that, there are so many activities for the patient they can use. But usually our patients, they don't like, especially the older ones, they don't really like to use all these apps, alright. But then there are so many things that are available. But remember I said when talk about processing speed, it always comes with the one component, time. So you cannot simply ask a patient to play or do activity just like that, open like that. So you must always play something that has timer. Alright, so when there is a timer, like for example, like some kids they play shooting game, right? So if you don't shoot within the time allocated, you will lose the game. So when there is a timing component, so automatically you will be trying to do fast. So it's indirectly it will work on your processing speed. This one I tried this on my patients, like for example, we do like upper limb training, they need to like shift things, but I time like within 5 minutes you must finish 20. So when you do, you add the time factor, so you can see the improvement in the cognitive function. Like even patient to respond to you also, you can see the improvement on patient. So yeah, this is one of the things that we can explore on the this one, apps and technology. And there is one thing, this is something new that I come across, and then I'm still studying on this, and a lot of recent studies talking about time pressure management. Time pressure management is like, how to say, it's not like the computer-based training, it's like more remedial, right? But time pressure management is the compensatory method. That means how those people with slowing down processing speed, how they want to do their activities of daily living without any stress. Alright, so this is the cognitive strategy that aims to reduce disabilities arising from mental slowness. It's based on McConn's task analysis describing level of decision making in complex cognitive tasks. So this time pressure management consists of a set of alternative cognitive strategies that allows patients in real life tasks to compensate for their mental slowness. So this one involves few stages, because first they have to think ahead, like before they do certain things, like for example cooking lah. So before they do, they already like practice mentally what need to be done for the cooking thing. So they need to think ahead on the steps to complete the task from start until the end. And then they need to visualize what they want to do, whether they will have enough time to finish the task according to what the steps are. And also we try to encourage them to not to do multitask. That means one task at a time. So this one indirectly can improve their processing speed because it's more organized and all. And then the second step is to anticipate challenges. It's not only what you want to do, but what are the challenges can occur. For example, if like when driving, if suddenly your petrol finishes, what you want to do, where we can go, alright? Or if you are going to one place, for example, you want to go this shop to buy something, how if the shop is closed? So you have to have you anticipate what are the problem may come, alright? And then the third step is to execute the task. Okay, you use the plan B if is needed. That means you won't be challenged. I mean, you will still do your activity. All right. And the last thing or last step is the reflection. How you did the task for the day. All right. So that's the time pressure management. All right. There's more people are using it now in their therapy sessions. All right. The last things that I want to share here are occupation-based training. This comes back to my background as occupational therapy, where I said before, we use the daily living activities as a therapeutic medium. So we always believe that occupation, things that you already do daily, is already in your brain. It's already transcribed in your brain. What are the steps you have to do? Like when you give patient another new task, it's a new learning is involved. When you do something they already doing, your what is that? The data is already there, but you need to train only. All right, the learning is not what is that? The new skills no need to be learned. So you take throughout the day what are the things you have to do. For example, and like I said, you always must have time. So that's why you have to, like for example, they have to finish. They sit and eat the breakfast. They must finish 15 minutes. So when you have the timing, so without, I mean indirectly or unconsciously, they try to do fast. So with that, they can improve in their processing speed. And occupational engagement, that means you are encouraging patients to do, like for example, some of the patients, they always have caregivers who do things for them. Why? Because when the patient do the things, become longer. Like mandi, right? Like to take shower. So if you let them to do by themselves, they will take maybe 30 minutes. But if the caregiver do, maybe 10 minutes is already done. But then you have to think, you have to use that taking shower as a therapeutic medium. So let the patient do, but you set them time. So you must finish by then. So then that can improve their processing speed, because they have to think and like what I must do next, I must do fast, right? So it's like unconsciously it will improve the overall cognitive function. Alright, so brain training may improve the specific skills being trained, like the generalization. We always talk about generalization, how the computer-based training, how the tabletop tasks like worksheets and how it can implemented in your, like reflected in your daily living activity. But most of the training is not generalized. That means maybe they improve in terms of memory, but then when it comes to occupational performance, patient can't perform. Why? There is no integration. Alright. So in terms of generalization, little evidence that the trained skill can be applied to overall over real world setting. So what is the solution? If find about occupational based training, there is no enough evidence just yet for the cognitive part. But usually for physical rehabilitation, a lot of studies talk about occupational based training or task specific training, where patients show better improvement rather than those robotic or all those machine based training. Alright, so it comes the same thing for cognitive impairment as well. So I do believe that this engagement, occupational engagement in daily living activities, not only for the patients, but generally for all elderly people. So like just now in the plenary, somebody asked about, like some kids say to the parents, don't do, you will fall and all. Some people say you need to do, but you need to come to the center. You need to do activity but safely. So for that you need the team, the professional team to work together. So for example, we OTs, we know how to do activity analysis, how to perform the tasks safely. Alright. So I think occupation-based training is very important for both physical and also cognitive training. And also there are far more data to support regular exercise, social engagement and conversation, lifelong learning, a healthy diet and sleep, and a variety of other factors that can help us maintain as much as we want. My take-home message will be, try to address that processing speed, which can contribute to the overall cognitive function. With that, I thank everybody. These are my as references. And I welcome questions if there is any. I try to answer if I know. Correct? Yes.
Thank you, the wonderful so it's about cognition and reaction time and how we go about it. I'm glad that we have a lot of interventions mentioned, but if there's any questions, I open first.
I'm Dr. Ng. I am an occupational health doctor. I would like to ask Ms. Regina, do you have experience in rehabilitating? I have a patient who is just in his early, about 40 years old, and he had encephalitis. So post-encephalitis, he experienced this cognitive processing slowing down quite badly, and he works as a software engineer.
Alright.
So it's a great challenge for him to solve problems at work.
Yeah.
Have you got this experience? And what would you how would you approach?
Alright. Yeah, I have treated, I think not encephalitis, post-meningitis. But of course, meningitis and encephalitis have more cognitive impairment. But it's the same concept, doctor. It's like neuroplasticity. You can work on the neuroplasticity, and you need to work on the specific cognitive training. For example, for him, if you want to his goal is to return to work, usually what we will do, what are the tasks he need to do in his work? So for that task, you do analysis and you make it small steps and work on each task. maybe he don't have physical limitation, right? So it must work on the cognitive part. And also the therapist must know which part of the cognitive component is affected. But from my talk, if you work on the processing speed, that means everything need to be timed. So that can give some improvement.
So
Yeah.
essentially, I should refer to
Yes.
occupational unit.
Yes, yes.
Thank you.
Thank you, Dr. Ng.
Thank you. The next question.
Yeah. Thank you, Ms. Regina, for that really interesting talk, and also the need that it is not just the IPS, but also in the context. Question is, if I may, in terms of the increasing the processing speed, from an academic point of view, we know that there are a lot of students. Some of the students who are fast and quick. Some of them are not so quick. But everybody striving towards to be the best. Is there any work in academic setting to help students improve their cognition and their general performance academically? And also, second question, what about in non-cognitive things like attention, maybe attention deficit disorders and so forth? What's the evidence in that sort of thing? Is there any work on that sort of thing? Thank you.
Yeah, when you search about processing speed, they always talk about performance at school as well. So that's why some kids, they cannot perform at school because of the processing speed. So the technique that they use is more on compensatory techniques, like I said just now, the time management, time pressure management. That means these people, maybe they have problem in multitasking. So if you ask them to do many things at one time, maybe they cannot perform. So they have to analyze their own, they have to plan and organize their learning process. For example, for today, what are the things they need to learn? They need to do a schedule, and what are the things, they must go one by one and master each steps. Like if they want to do everything together, maybe it's difficult for them. But I have to agree, my work is more on patients rather than the healthy population. But there are many studies they're doing for the learning more on executive function training. So like they work on the attention, planning and organization, how the compensatory method can help with their main learning process. Yeah. And also you talked about attention, right? Those with attention problem, that's why I said the processing speed, when talk about it, is not only like stand-alone component. It affected by other factors as well, but one of it is attention. The processing speed, that means you have some senses coming to you and then you have to process. But attention, when you don't attend to the input, then it's automatically will affect the processing speed. So in that sense, you have to work on the attention as well. Then only it comes to the other processing activities. Yeah. Okay. I hope I answered your question.
Okay, there's one more.
Ms. Regina, it was a very interesting topic. Now, my question is, hearing all the questions, don't you think interest plays a very important role in learning itself? The moment you put interest in the child or anyone, I think it increases the learning capacity. I just want you to explain on that.
Yeah, I agree 100% with you. It always comes back to the person. So in occupational therapy, we always talk about client-centered approach. So it always comes back to the person, what they do, their daily living. That's why I said, like when you do the task like worksheets, maybe it's not something that they want to do. That's why we must always go back to their occupation, what they do in their daily activities, and then from there, your training, you should use whatever they are doing. So for example, their interest in music. So you have to do something to do with music. So if the person don't like cooking, you cannot do cooking tasks with the person. So it always goes back. And another thing is there is a model called PEO model, person, environment, and occupation. So to achieve the performance, independence and all, these three components must be addressed. So the person comes in picture. I think interest is the main factor as well, to create the interest. Yeah. Yes.
Good morning. May I know how do you measure the processing speed, and can a person with a slow processing speed drive?
Yeah. Alright, to answer the first question, the assessment, usually this specific component assessment is done by neuropsychologists or clinical psychologists. They have better instruments to assess processing speed. So they are DMT digit, there is some tests that you use, but for occupational therapies, the other one is called SDMT, I don't remember the full term, but then for occupational therapists, usually how we measure is, there is one assessment that for neuro patients that we use is like Chessington Cognitive Neurological Battery, CONNEB, where it measures the ability of the patient and also the time they take to finish the task. So usually sometimes our patients, they can do the ability, but when you see the time taken to finish the task is impaired. So as therapists, we analyze from there and then we know that the ability is there, but they're taking longer than the normal people to finish the task. And one more assessment that I usually use is the TMT, trail making test, but its original is not for processing speed, it's visual attention, but you can interpret the result into the reaction time and processing speed, because one of the pre-driving assessment, most of the countries or OTs, they use trail making test as one of the component for driving assessments. But then they have how slow is slow. So that's answer your second question, to drive. So that's why to drive, reaction time and processing speed very important. If they have their normative data, so if severely impaired, we don't allow patient to drive, and then we will recommend for rehabilitation first for maybe 3 months and then reassess again. Alright, if it's within the normal limits, we allow them to drive. But its ultimate decision is by the doctors. Like this is our recommendation to the doctors. And if you're not sure on the ability, we have driving simulators. Usually they need to perform the driving simulation, and then from there there is analysis of the data where they say that patient has reaction time problem, maybe they don't allow to drive, which is dangerous for the person and others on the road.
Okay, then we have a question from virtual participant. One last one. Yeah, we have 1 more minute. Okay, the question is tinnitus part of dementia or brain decline? Tinnitus is the ringing of the ear.
Ringing in the ear.
Is that yes?
Sorry, I never come across anything about tinnitus, but tinnitus always comes together with vertigo. But I'm sorry, I'm not sure about it.
Yeah,
but generally, when there's something going on in you, but your attention will be gone, and ultimately it will affect your processing speed as well.
Yes, and tinnitus is associated with a higher risk of early onset of dementia. So I hope that answers the question. So join me to thank Ms. Regina again for the talk. Thank you. We'll adjourn for the next session.
Thank you, Mr.